Well, thank you everybody for attending this great conference. Thanks for having me. I'm happy to be the last, hopefully the not the least speaker. Again, I really appreciate these patient advocacy groups and all the patients that are here today, and hopefully ones that will be eventually watching this live for your attention. So I'm going to talk, my objectives were the importance of professional therapy and side effect management, getting the best out of treatments, and discussion about living with the diseases, influencing factors such as nutrition, coping, challenges for patients, and challenges for carers. So, you know, you guys have been attending this conference, and there's been a lot of medical information, out there. And basically what all this medical information means is that prior to 2000, just was a bad diagnosis, okay? There weren't a lot of treatment options, and these tumors can grow quickly. But the discovery of the KIT gene causing the overexpression and constitutively activated KIT protein, meaning that the KIT gene turns on the receptor, and this receptor tells the cells to grow and divides. So the receptor is always being turned on, and that leads to the cancer cell growing and spreading, okay? So now we have 5 FDA-approved drugs and multiple other tyrosine kinase inhibitors, which means multiple other drugs that, that stop the cell from growing shown to be effective. And there have been multiple studies, and also obviously people out there, such as yourselves, that show that if we continue treatment with a TKI, meaning we continue treatment on a medication, you can live, okay? And there's also data showing that placebo data, which you've seen, that if you're not on a medicine, the tumor will grow rapidly off treatment. So bottom line is that the receptor is constantly turning the cancer cell on, so it must be turned off at all times, which means you must be on your treatment at all times, okay? So, and the importance of professional therapy. Okay, GIST experts, they know the data, as you see, right? A lot of it's over your head. A lot of it started, when I first started, I was way over my head. Now I'm finally understanding enough to explain it, right? Okay, and that the importance of the mutation status to determine the dose and the proper TKI. When I say TKI is treatment, okay? And to understand the plan and the backup plan. As medical oncologists, we always have the plan for you. And then when we get scans and we're waiting for the results of the scans, you're nervous waiting for the results of the scans, we already have a plan for you. We already know, okay, if this one doesn't work, we got this one. We got this one and this one. So the sarcoma medical oncologist, a GIST expert, is always working on that backup plan. And we also work with multidisciplinary groups to ensure best outcomes. So we have the sarcoma medical oncologist, we have the expert pathologist. As we know, it's very important to get the pathology properly reviewed. And we have surgical oncologists, radiation oncologists, interventional radiologists, all there at our centers to be able to help best manage you. So if you're unable to get the direct care of a GIST expert, which isn't always the case, then you at least need to ensure that GIST expert is at least indirectly involved, okay? So some of these things, like if you're not close to the center or your insurance doesn't cover it, then at least try to arrange 1 to 2 visits with the expert a year. Now, with COVID-19, we now have implemented telemedicine. And so this has been a game changer. So this gives patients opportunity to go and see a GIST expert, but maybe not have to travel. It's not as good, obviously, as being face-to-face with the GIST expert and the GIST expert doing a physical exam, but at least you have the option. And then if that's not the case, at least make sure your oncologist is direct contact with an expert, okay? So get the name, be like, oh, who was the expert? Look them up, okay? Make sure your oncologist is in contact. And then you can also contact your GIST support group for options, okay? I'm also on the board of Sarcoma Alliance. We have grants for patients to get second opinions. So take advantage of all these opportunities so that you can be with a GIST expert and you can live as long as possible with the highest quality of life. Okay, so now let's talk about how are we going to keep you on these medicines, okay? Let's talk about side effect management. Now, one of the most common effects of, sorry, I didn't have my slide. All right, there was a slide that had all the side effects of treatment and, but I don't know what happened to it. Hold on 1 second. Sorry. Okay, well, that slide's missing, so that's fine. Okay, so nausea is one of the most common side effects of having GIST, okay? Causes, we have to find out the causes, right? Pain, anxiety, constipation, dehydration, malnutrition, reflux, certain foods, motion sickness, infections, tumors, and medications. So you have to figure out, you know, is it your treatment, the medications, or is it everything else, okay? So first we have to figure out, well, when are you getting nausea? So you can keep a log of when you're getting nausea. Is it associated with the medication or GIST, okay? Is it from the tumor? Then you have to take nausea medications. And if it's not, there's other things we can do. So you try to avoid the triggers. For example, some people don't even realize that they get nauseated when they're in the passenger seat, or especially if they're reading. They know, okay, reading while driving, I can't, but what about texting and driving? That's the same thing. So no texting and driving, even if you're the passenger, right? And you have to stay well hydrated, and you have to keep your pain level less than 2, okay? Because pain can cause nausea too. And then look at your urine. Are you hydrated well enough? Do you have a hidden urinary tract infection? And you can use some home remedies like ginger tea, etc. Now there's antiemetics, which are the nausea medications. And a lot of patients are on these nausea medications, okay? We have the ondansetron, Zofran, one of the most common, it does not cause fatigue. So you can take that during the day. Ativan is good for at night, and also Razapam, it's good for at night, or if it's anxiety ridden. Sometimes people get scanxiety, so they're going to their doctor, they're getting the scans, they get a little nauseated. They can take the Ativan or at night. Compazine can work if Zofran doesn't work. That could make you a little tired, so you want to take that at night. Phenergan is helpful if you have a lot of tumors in your abdomen pushing on the small intestine. That helps move the food down. Phenergan, Reglan does that. And if Zofran works, there's the Sancuso patch, which can be helpful. This is expensive, but you may be able to get some discounts with the drug company. So how do we cope with these nausea and vomiting? So you want to take your antiemetics, your nausea meds as instructed. It says every 8 hours, if it says whatever, read the bottle. Okay, you want to have small meals throughout the day instead of 3 large meals. And you want to try to drink as many clear liquids as possible, especially if you vomited. You want to avoid getting dehydrated, because then that can continue the cycle of getting nauseated. And talk to your doctor about IV fluids. Some of my patients, they just can't keep up with it. You know, once you get dehydrated, you can't drink, because then your stomach is full and you get nauseated. We can set you up with some IV fluids for a couple weeks in a row to get your levels back, and then you can drink more. So definitely talk to your doctor about that. You can freshen your mouth with homemade a mix of baking soda, salt, and water. Swish it out and spit. Try to eat some bland foods instead of very fat, sweet, greasy. you have to keep a diary of food and see like what is causing this. You know, some things it could just be something that you're eating. But when you are nauseated, try to eat some dry foods, crackers, toast, dry cereal, and then talk to your doctor about reflux medicines and the timing around the GIST medicines. So a lot of the medications, you're not allowed to take a reflux medicine, but there are some where you can, if you took the reflux medicine in the morning and then your GIST medicine at night, and we're able to do that because a lot of GIST patients have reflux because maybe part of your stomach was removed, or, you know, also if you have tumors in your abdomen, that also causes the reflux. Other things, you can get decreased appetite and low, so to deal with that, you have to have small meals throughout the day. You have to slowly stretch your stomach out and like look at your, you know, what happens is that you're so used to eating when you're hungry and not eating when you're not hungry. But if you've had tumors or you're on a medication, you may not get hungry, but you still have to eat. So you have to say, okay, it's my time to eat, and you have to use food as medicine. Okay, just like you don't like the taste of your Gleevec or your Sutent or all your other medications, you may not like the taste of food, but you have to treat food like your medicine. Okay, make sure you keep your food stocked with the different kinds of foods, have a bedtime snack, and try to make sure you have your protein-rich foods, drink lots of fluids, and then, you know, when you're eating, try not to drink while you're eating because then you'll get too full. Okay. You can have some altered taste from the medicines. So you can have foods that with some tart flavors, lemon wedges, lemonade, marinate your foods in balsamic vinaigrette, like season your foods, eat some frozen fruits. You know, there's just some little tips if you have metallic taste. That's more for chemo, but you could still get it with this tyrosine kinase inhibitors. You can use plastic instead of metallic. So diarrhea, you know, again, the causes of diarrhea, certain foods can cause diarrhea, medications, tumor and prior surgeries, and infection. So how do we treat those? We want to keep a food diary. You know, see, everybody is individual. So, you know, someone may say, oh no, spinach is bad for me. And then someone says, oh no, you know, fruit is bad for whatever it is. You're your own person. So you have to figure out what is the culprit that's causing your diarrhea. And then if it's all that, and it's not medicines, if it's not food and it's not an infection, then it's the medicine, at which point, as we said, we don't want to stop the medicine. So we have to add a medicine. So some people think, oh yeah, all I have to do is take Gleevec or Sutent. No, actually you wind up having to take several medicines instead of just one medicine, because you need your nausea medication and you need your diarrhea medication. Okay, so you wind up having to take 4 or 5 medicines, but we want you to live a long time and we want you to have the highest quality of life possible. So if that means you have to take 5 medicines a day or 10 medicines a day, you got to do whatever it takes. Okay, so medicines, there are 4 diarrhea medicines we can use. We can start with over-the-counter loperamide. Now, for the Europeans and people in other countries, these may have different names. So I apologize about that, but you can always, you know, Google it, whatever is similar to what's in your country. Okay, Lamodal is a prescription, so that's stronger. So you start out with 2 Imodiums after each loose stool. If you're having more than 3, you need to let your doctor know, okay, I need to be on the prescription one. You don't want to be having more than 3 because that will lead to some diarrhea and some wasting of potassium and electrolytes. So you take Lamodal, same thing. If Lamodal doesn't help, we have tincture of opium, and then which is a liquid. And then if that doesn't work, we actually have a subcutaneous injection octreotide. So we don't want, again, we want to get it under control. Okay, we don't want any accidents. Okay, that doesn't help your quality of life. So coping with diarrhea, again, some tips: avoid high fat and spicy foods. Try to go with more bland foods. Add banana applesauce. This is that brat diet: banana applesauce, rice, oats. Limit the lactulose and sugar. So some people have to avoid dairy. Some people don't. So again, you have to test what works for you. Hot caffeinated beverages, and watch for medicines containing magnesium. Now, some people have the opposite. Okay, some people have constipation. Even though most of the medicines says it causes diarrhea, I have people that have constipation. Mostly that's due to dehydration, certain foods and medications, and the tumor itself. Okay, remember the tumor's in your GI tract, okay? So if you have tumors that are interfering with the GI tract, then you can have backup, and it's going to cause constipation, and then finally the food gets pushed through, and then you can have diarrhea. So if you have tumors here, again, it's going to push that. So you want to, if you have a lot of tumors in your abdomen, you want to stay very well hydrated. You want to be eating your fruits and vegetables. You want to be having stool softeners. You can take Miralax, Senna, enemas, mineral oil. There's lots of things that we can do. You don't want to let your, you want to have a bowelman at least every 3 to 4 days, okay? Maybe before all this, you were on the regular, once a day, twice a day. That may not be realistic for you. You may have to just say, okay, fine, I'm not gonna have a bowel movement every day, but you want to get it out by 3 to 4 days because that's going to make you feel uncomfortable, okay? So you may just have to use extra things, and again, you have to be placed on some sort of regimen and work closely with your diet, okay? So for constipation, you want to eat at the same time. You want to drink a lot of your plenty of fluids. Okay, now here I have ounces. For the Europeans, you guys go by liters, but it's basically, you have to use your weight. It's basically a half to a third, 2/3 of your weight body in ounces. So for example, if you're 180 pounds, then you want to be drinking 90 to 100 ounces, 90 to 120 ounces a day, which is about, 3 to 4 liters, or, almost a gallon, okay, of water every day, okay? And again, you want to eat foods that are high in fiber, okay? Swelling edema can cause swelling and edema. Medication can cause it, blood clots, poor nutrition, heart dysfunction, and kidney dysfunction, okay? So how do we manage it? Diuretics, okay? We can use Lasix. We can try to avoid salty foods. You want to keep hydrated, okay? Keep your legs elevated. You can get compression stockings, okay? And a lot of times someone has such bad swelling or their abdomen's really distended, it's hard to get the compression stockings on. I've actually had to been a marriage counselor for people because the wife or the spouse is like, I've been trying to help him. It takes me 15 minutes to get these compression stockings on, and everyone's fighting. Well, there's this little tool that you can get. You can Google it on Amazon. It's like $20, $20 or $30. And you put the stocking over, and then you can pull it up yourself, and you could save your marriage, okay? So that's very helpful. Those are very helpful. A lot of centers have lymphedema clinics, okay? And that's part of the physical therapy. So you can ask your doctor about lymphedema clinic. They wrap your legs. That's very important. Increase protein intake. If you have low albumin, which could be caused by the disease, you want to bring your protein, and malnutrition, you want to bring your protein levels up. What happens is when you have low albumin, fluid leaks out of your blood vessels. The albumin keeps the fluid in your blood vessels, so it leaks out, and that's why you have the fluid. So you want to try to increase that and avoid very hot showers. In the summertime, fine, but I guess it's starting to snow in various places. Miami, I don't have to worry. It's easy for me to tell patients in Miami avoid hot showers, but for the rest of the world, it may be a little bit difficult. But at least have a lukewarm, because when you have hot, the blood vessels, get engorged and they leak out, okay? I realize I'm already low on time, but anyways, skin and hair changes. Hair could cause thinning and whitening and skin changes, and you guys should all be looking at these pictures if you're on sunitinib or regorafenib, and you have various degrees, okay? Would be like a grade 1 where you have just the redness, but it could lead to blisters. So you want to be making sure you're using creams with urea base. I have everybody just use the creams twice a day, even if their hands are completely fine. It can prevent it, okay? And you have to let your doctor know if it gets to this painful part, because they can stop your medication, lower it, give you the creams. There's over the counter, and then there's prescription urea-based cream. So very important, okay? Avoid hot water. For women out there, if you're young and you're on something that whitens your hair, it's okay to dye your hair, okay? You don't have to, my mom is 80 years old. I never saw gray hair in her head. She's has brown hair like me, okay? So it's okay to do that. Thinning of the hair, that the newer drug ripretinib can cause some thinning or even really a lot of hair loss, at which point you can use wigs and such. And now finally, if you tell people you have GIST, they don't realize it's a cancer because you have hair. How can you be on treatment? You still have hair. Now you can be like, I told you I really do have cancer. Okay. Fatigue is something that's persistent sense of physical or emotional tiredness, exhaustion related to cancer treatment that interferes with your normal activities, where you feel weak all over your body, you have difficulty concentrating, waking up after tired. If this was a live visit, I usually am like, who's fatigued? And everyone raises their hand, including the doctors and everybody, the worker, even people that don't. So you really have to get a hold of it, because it can cause difficulty sleeping, difficulty concentrating. If you wake up feeling tired after sleeping, lack of energy, lack of motivation, those are all signs of fatigue. And if they're persistent every day or nearly every day for a 2-week period. So every once in a while you feel tired, you didn't get a good night's sleep, whatnot, but if it's persistent, then that's considered fatigue. So causes of fatigue: pain, dehydration, depression, anemia, vitamin B12 folate deficiency, low thyroid. So I do what's called a fatigue workup. I get blood counts, I check iron levels, vitamin B12, folate, urine. Sometimes hidden urinary tract infections can cause fatigue. Sometimes C. diff, infection in your intestine, cause diarrhea, but you have normally diarrhea from your meds. Well, so all those things we want to look for. And poor nutrition and poor sleep, okay? So number one, again, this is a constant theme: hydrate, 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 okay? Make sure you're hydrated, because dehydration, you'll see. I tell patients, if you're not annoyed by how many times you have to go to the bathroom, you're not drinking enough, okay? If you're drinking 8 to 10 glasses of water every day, you're going to the bathroom 8 to 10 times. So if you wake up and it's noon already and you haven't even gone to the bathroom, you're not drinking enough. Look at the color of your urine. If it's clear or light, then you're doing a good job. If it's dark, you need to drink, okay? Also, pain. We want to keep the pain level less than 2, all right? So if it's not less than 2, then the pain could be causing that, okay? Also, ask your doctor to do the fatigue workup, as we talked about, and sleep, okay? Most causes of fatigue are you don't get enough sleep, all right? So you need at least 8 hours of sleep, all right? Now, you might have been, before your diagnosis, one of these people that got 4 or 5 hours of sleep, or whatever. It's just not gonna happen, all right? You have cancer, you're on a medication, you need more sleep. So at least 8 hours of sleep. If you can get 10 to 12, that would be great. At least 8 hours, and exercise. In the past, we used to tell patients, oh, just rest, don't do anything. But now it has been proven that exercise can improve your energy level and actually make you tolerate your treatment better. And you have to prioritize your activities, okay? I'm really, so first you have to evaluate what your fatigue level is, okay? Think about it. Are you having no fatigue, mild, moderate, worse, okay? And then you have to conserve your energy. You may not get to the point where you had the previous energy before you had the gist, okay? And so you have to prioritize. You can see, and there's different energy conservation techniques, you know, avoid bending, using you can use a reacher. You know, if you have large tumors in your abdomen, maybe too difficult for you to get things from the floor. Don't be afraid of using a walker, okay? Especially this one with a little sit thing. And if you're at the grocery store, you could sit down and use it. If you're trying to do activities, cooking and all that, it's okay to have a stool and sit while you're cooking, okay? And take some recovery breaks. Do a little, rest a little. And there's some key strategies here. Pace yourself, figure out, you know, think about how much energy you have and what's your activity. If it's low, okay, you can do your activity. If it's high, you can do your activity. If it's low, you need to rest. And what are my important tasks for the day? Okay, so you spread out the activities between morning and afternoon and evening. Think about what time of the day you have the most, most energy. Are you a morning person? If so, do a lot of your activities in the morning. You may be a night owl, fine. Rest in the morning and do your activities at night, okay? Changing positions. These are some of the things I realize I might have had maybe going a little bit slower. So I'm going to kind of speed up and maybe speed through some of these. You know, some examples: sitting on the chair when you're getting dressed, sitting at a table for meal prep. Exercising is very important. Published research. So when we say published research, you know, there's a lot of information on the internet, as you know, that says you need to do this and you need to do that. But are they really published in journals? Are they really, you know, accurate, or is it just something that you read on the internet? But really, there's published data that says research that exercise is safe for cancer survivor and aids in the management of cancer-related fatigue. So it can improve physical functioning, improve your balance, increase your strength, decrease fatigue, decrease pain, improve your heart, increase your energy levels, and improve your quality of life. Okay, so they recommend for cancer survivors. This is a little bit different than if you're actually on treatment, but if you're off treatment or if you're on a mild treatment, you know, you want to be getting your aerobic exercises, okay? You want to be doing resistance and you want to be doing flexibility. So it doesn't necessarily have to be this many minutes per week, at least do aerobic, resistance, flexibility, okay? Examples of aerobic activity. People think of like, oh my gosh, it has to be jogging. It doesn't have to be jogging. It could be just walking. It could be hiking. It could be swimming, whatever makes you happy, dancing, hula hoops, okay? I am a hula hoop expert. I don't know if we were a live meeting, maybe I would have brought my hula hoops and show you. But anyways, all these are activities. So do something that's enjoyable to you, that's going to get your heart rate up, okay? Resistance activities. These are simple. You know, we have COVID going on right now. You don't have to be going to the gym, okay? So there's a lot of things that you can, or you may not even have a gym membership, even if you didn't. You can do a lot of these things in your house, in the comfort of your home. You get to wear whatever you want. You can rest whenever you want, okay? You take a chair and there's different activities. You lift up your leg, lift up, you know. If this were live, I may show you some of these activities, but I won't show you now because I'm only having a professional top. So anyways, I have my pajama bottoms. Okay. Anyway, not really, but anyways, I've been a Zoom expert for a while. But so, you know, there's different activities here. And if you look at these slides, you can see these simple tasks. Now, if you have tumors in your bones, you may want to talk to your doctor about doing some of these activities. Also, some abdominal activities. Make sure you talk to your doctor about some abdominal things. But for the most part, you know, here's some upper body, sides and back. And if you don't have weights at home, you can take a simple water bottle that's a pound, or you know, at 16 ounces is a pound, so you can use that, or you don't even have to use weights, you just use your natural arms. And you don't want to start out, you know, like you're a bodybuilder. You want to start, if you haven't done any exercise, you have to really start out very slowly, okay? Otherwise you can get injured. And it's important to do stretching. Stretching is very important, especially patients on Gleevec. You get the hand cramping and everything. You want to be hydrated while you're exercising, and you want to be stretching, okay? And balance, you want to be using chairs and try to do some balance techniques. We don't want anybody falling. So again, if you have any of these issues, unusual fatigue where you just feel like you're not gonna make it, severe shortness of breath, you know, heart palpitations, should be able to learn how to check your heart rate, okay? You know, you can check it over your carotid. Normal heart rate is 60 to 100, okay? So just count for a minute. You should be able to feel your pulse. Normal is 60 to 100. When you're exercising, you know, you want to maybe get to 120, 130. But if it's feeling like really high and it's not going at a normal pattern, definitely, you know, stop and tell your doctor leg cramps, headaches, or vision changes, okay? Pain management is very important. Pain is subjective, okay? It can cause fatigue, irritability, decreased appetite, nausea, vomiting, problem sleeping, depression, and it's a constant reminder that you have a medical condition. So you really need to find out what's causing the pain so you can treat it properly. So causing pain, the tumors itself, of course, but other causes, is it gas pain, diarrhea, cramping, constipation, reflux, muscle cramping or tightness, or arthritis. So we use this pain scale, and I tell my patients, our pain goal is 0 to 2. See, these people are smiling. We want everyone smiling. We want to make you live longer with happy, okay? Smiles. We don't want people depressed and frowning and crying, all right? So we want to keep a pain diary, maybe related to food, certain positions. Assess your pain level every few hours. What's my pain level? The best, and if it's not related to food or anything, it's just from tumors, narcotics are the best way to treat, okay? We have oxycodone, morphine, hydromorphone, Dilaudid, okay? So we start with short acting, and we keep a pain log every 24 hours. We see how much you're requiring, and then we can put you on a long acting. MS-Contin, OxyContin, Duragesic patch. Exalgo is a newer drug that's extended Dilaudid. So it's and patients always, and family members always worry, oh, I'm gonna get addicted to the pain medicines. And there's this whole big thing about, oh, pain medicines are bad, addiction is bad. It's very, very rare that cancer patients get addicted to pain medicines, okay? People that get addicted to pain medicines are either people that were maybe in a car accident and were on pain medicines. They didn't initially get the euphoric effect. As their injury improved, then the pain receptors went down, they get the euphoric effect, and then they get addicted to it. Or people that don't have cancer that are seeking it, and they get the euphoric effect. But if you have cancer pain and you take a pain medicine, if you don't get high, you're not going to get addicted to it, okay? Now, if you have too high of pain medicines and your pain level is 0 and you keep taking it, yes. So talk to your doctor about that. Mental effects, there's memory issues, anxiety, depression, and stress. So we have anxiety. Maybe if we could have someone mute their line.
Yes, please. If you are not presenting now, if your name is not Dr. D'Amato, please mute your line.
You may be able to mute her yourself.
Yes.
You can mute her out too. Okay. Okay, thanks.
Gotcha.
All right, so we have anxiety and stress. Scanxiety. I don't know if you've heard of it. We've made it up, but I'm trying to get it in the encyclopedia, okay? At least in Wikipedia. All right, scanxiety is when you're due for your scans. It can happen the day of the scan. It can happen up to a week of the scan. All of a sudden, you're feeling anxious. You don't know what's happening. Oh, I'm due for my scan. It's similar to menstrual cycle, okay? For women out there, you know what I'm talking about, okay? And so the internet can cause stress, news, family issues, negative Nellies, people that are around you that are just negative people. Oh, I have a friend that had breast cancer, and then her friend, she runs into her friend, oh, my aunt had breast cancer. She died of breast cancer. It's like, why are you telling me that my aunt died of breast cancer? You should be telling me, oh, breast cancer. Oh my God, I have so many friends that survived breast cancer. Okay, so you got to watch out for those negative people. You don't want to hear negative information. You want people to be positive around you. And anxiety, depression disorder, okay? So for scanxiety, talk to your doctor. See if you can get the appointment close to the scan. Most centers, you can get the scan with results within 1 to 2 days. It doesn't have to be a full week, okay? It's really nice for the patient to get the scan the same day, but sometimes that can be stressful for the doctor because, again, we have to come up with our backup plan. So if we don't have our plan for you, we need time to come up with the plan. So that's why we need that extra day to have that plan, even though we already have the backup plan for you, but still, we need to see it. So the following day is at least good enough, but if you really need it the same day, sometimes you can do it. Limit the internet, okay? Yes, it's good you found us on the internet, and it's very helpful because it brings programs like this together, but you have to be careful what you read on the internet. Avoid the news, all right? It's crazy times these days. You can get some information. We want you to be totally in the bubble, but a couple minutes a day, that's all you need. I actually have my husband filter the news for me. He likes to watch the news. So I'm like, if there's anything that I really need to know, it'll tell me. A lot of times, if you're working, you get emails from your work, and that will give you enough information, okay? You don't have to be watching the news all the time. And then relinquish control of family and friend issues. A lot of times it's like, you just say, I just can't deal with these things. You're going to have to take care of it yourself. You might have been used to being the caretaker all the time. You may just say, you know what, you're going to have to deal with your own issues. I got my own issues. A little bit of denial is not a bad thing, okay? Do you have to know all the time that you have cancer? No, you can just, yes, you have to take your medication and you have to go to the doctor. Other than that, you want to be keeping your mind busy with other things, okay? So you have to come up with an escape mechanism, okay? If you get really stressed, you can think about what's gonna, where's my happy place, okay? Let me think of the beach. Let me think of the mountains. Let me think of something and just take deep breaths. Deep breathing is very important. Why do people get it? Why do people think cigarettes relax them? Cigarettes actually do not relax you. All it does is just jack up your heart rate, okay, because of the nicotine. But why? Because they're stepping away from their environment, okay? They're in a situation, they have to leave their environment, they have to go outside, they have to take deep breaths in and out for 10 minutes, for about 5 minutes, 10 deep breaths in and out, okay? That's one cigarette. So I'm not telling you need to smoke cigarettes, obviously, but do what they do. You're in a situation, go step away, deep breaths in and out, close your eyes. And meditation, it's a great learning tool. If you can learn how to meditate, you should definitely do it. And then you can teach me. I've tried to do it myself. It's very difficult, but it's like amazing if you can. You just clear your brain. I have a problem clearing my brain, but if you can do it, hands up to you. And anti-anxiety meds, if these situations are interfering, as I tell patients, you have normal anxiety and sad moods, but if it interferes with your daily activities, your sleeping, your eating, and your relationships, then you need counseling and you may need medication. Okay, so don't be afraid to ask for help. Okay, so again, major depression. You have the SIGI CAPS, which is depressed mood, loss of interest, loss of concentration, low energy, low appetite, pain, fatigue, negative environment, stress. So that's depression. So so we have to figure out, is it major depression or is it due to pain, fatigue, negative environment, and stress? So you want to get your sleeping and your eating, cut down on the internet, don't watch the news, think of hope and living with cancer. Okay, you got to think that you're living with the cancer and you have hope. You listened to all these lectures today and you saw all the treatments that we have available, everything that's coming on the pipeline. So you want to have hope. And you may need antidepressants. Again, in conclusion, there's so much hope for gisters out there. You got to focus on the hope. You got to hydrate, hydrate, hydrate. Drink your fluids. Get your rest. Tell your doctors how you feel physically and mentally so they can help you. Okay, you got to open up to them. Let them know. All right. And remember, they went to school for all these years to help people, and they want to help you. And no watching the news. All right. And then, so I just want to thank you. Again, here's my contact information. Please call me. I want to thank my team at Sylvester. We have some new medical oncologists recently joining us. As again, Dr. Trent, he's been my mentor for this whole time. He was my mentor from the very beginning. Dr. Trent, Dr. Benjamin, Dr. Dimitri, Dr. Mackey, and Dr. Baker. Now I finally get to work with Dr. Trent. He recruited me a couple of years ago, and we've just hired another medical oncologist, Dr. John Zach. We have a pediatric oncologist. We have excellent pathologists, Dr. Rosenberg, and we just recruited Dr. Montgomery. Again, our whole team of people. So I really want to thank you for having me, and I'm open for any questions.
Dr. D'Amato, could you do